The following feature presentation contains educational material dedicated to trained clinical staff at Optimus Health Care.
Depression management integrated in primary care at Optimus Health Care. Today, we're going to discuss how psychiatric scales and its implementation are considered the gold standards to diagnose depression. These tools present common language to a screen and data that can be tracked to evaluate the patients. These tools, called Patient Health Questionnaires, are commonly referred to as PHQ-2 or PHQ-9. In order to comply with the latest guidelines of depression management in primary care, Optimus Health Care is expected to complete a thorough assessment, management, and follow-up of all patients who are 12 years old or older. If depression symptoms are found, the patient must have had at least one complete assessment within 24 hours of the screening in which symptoms were found. Additionally, the provider is expected to start counseling, complete an evaluation for depression, refer the patient to a provider qualified to diagnose and treat depression, request the patient to schedule a follow-up visit for depression, or start pharmacotherapy for depression if the provider considers it necessary. Procedure. Based on the guidelines and to recognize or diagnose a patient with depression during an initial visit, an annual physical exam, or as deemed necessary by the provider, a licensed nurse, a medical assistant, or a community healthcare worker will utilize, perform, and document a PHQ-2 screening for depression consistent in 2 questions.
So part of our screening process, I have to ask you a few questions on how you're feeling today. Is that okay with you?
Yeah, that's fine.
The staff member performing the assessment must stress if during the past month the patient has been presenting any symptoms of depression.
Over the past month, have you been feeling down, a little interest at all?
Yeah.
Okay, do you feel hopeless and depressed?
Definitely hopeless, yeah.
Okay. Alright, so that's it for now, and the doctor should be with you shortly.
The screener must document the findings by clicking on the screener menu and then selecting the appropriate specialty. If the patient's response to both questions are no, the screening is negative and no further action is necessary. If the patient's response to at least one question is yes, the screening is positive and the screener should hand out the PHQ-9 questionnaire for the patient to complete it. Additionally, the screener must inform the provider so that the provider will further assess the patient using the PHQ-9 tool. The PHQ-9 is a very patient-friendly, self-reporting tool that usually takes a couple of minutes to complete, and it is available in different languages. In Optimus Health Care, the PHQ-9 form is readily available in the exam room in English and Spanish. If another language is needed, the provider can access it on the EMR form or by using the following website.
Hi Nellie, my name's Dr. Smith. How you doing?
Okay.
Good. Is it okay if I ask you some questions?
Yeah.
Okay.
With the first 9 questions, the PHQ-9 evaluates symptoms of depression and the frequency of their occurrence. It is vital that the screener or the provider instruct the patient to complete the form thinking about the last 2 weeks. The patient should also be instructed to answer question number 10, located at the bottom part of the page, only if any of the previous questions were answered with a number from 1 to 3. This part of the test will evaluate the level of impairment produced by the symptoms. The patients must read the question and answer by selecting one of the answers to depict the current state of mind. When the form is completed, the provider will review all the answers and finally achieve a total score by adding the circle numbers. Afterwards, the provider should follow the Table 4 titled PHQ-9 Scores and Treatment Proposed Actions for appropriate and individualized interventions.
Alright, so Nellie, based on what you just shared with me, I'd like to recommend you see one of our therapists. What do you think about that?
You're not serious. Really?
For now, let's place the referral for behavioral health. Does that sound like a plan?
Okay.
Alright, excellent.
By utilizing this tool, the provider will be able to track the patient's symptoms, Furthermore, the patients themselves will be motivated to participate in the treatment process, will be more aware of their symptoms, will be able to quantify any positive or negative changes, which translates in patients being able to create treatment goals and sense out their depression symptoms. Due to its high efficiency and specificity, the PHQ-9 is an excellent method of communication tool between providers, as it serves as a method that can be used in all practices. Remember, by using the PHQ-9, the quality of care and the patient safety improve. Monitoring and follow-up. In Optimus Health Care, the provider will adhere to the AHRQ guidelines as described under the Depression Management Toolkit by the MacArthur Initiative. In addition, if the recommendation is to start an active treatment, the provider must refer to the AHRQ guidelines and to the Optimus Health Care antidepressant pharmacotherapy guidelines for treatment options. To satisfy the measures that will be reported to HRSA, the provider must review the PHQ-2 results, perform the PHQ-9 and document the findings, document any intervention by clicking on the depression follow-up field, and acknowledge if any antidepressant medication was or was not prescribed. Documentation in the electronic health record. The provider must document in the EHR by using the Today's Visit form, selecting the appropriate specialty, and logging in any treatment intervention. Remember, in order to be reportable, the provider must only use the required forms. The provider is responsible to document the PHQ-9 score, select the appropriate intervention, and acknowledge if any antidepressant medication was or was not prescribed. If the psychosocial counseling patient education intervention was selected, the provider may offer handouts in English and Spanish from the CRAMES online library by clicking on the link in the form. The finalized PHQ-9 form will be scanned under the image category Depression Screening. Optimus Health Care Depression Management Policy and Procedure includes an annex which details a suggested antidepressant therapy for adults, elderly, and adolescents. Further, the antidepressant fact sheet attached presents the side effects for different classes of antidepressants. Moreover, it includes a list of medications covered by Medicaid and the availability of antidepressants on low-cost formularies to assist the providers with appropriate treatment options.